Coolsculpting is developed by scientists at Harvard Medical School. It's an FDA-cleared device that works for non-invasive fat reduction. This is really used for stubborn bumps and bulges on the body that you want to get rid of. It's only subcuticular fat though, the fat that's right under the skin that you can grab. So Coolsculpting works on subcuticular fat, stubborn bumps and bulges on the body. Typically people that are about 10 to 15 pounds overweight are the ideal candidates, although we can do this on much larger people. It just takes a little bit more time and it also takes more treatments. So stubborn bumps and bulges that can be vacuumed into the applicator. If you can grab it, basically you can most likely freeze it. It depends. Most areas, the more popular areas are like the lower abdomen, the love handles, or the muffin top, the inner thighs, sometimes very rarely the outer thighs, sometimes the gluteal fold or right below the butt we can treat in some occasions. The upper arms, the back of the arm, the bat wings that we can treat, and the back. Sometimes if you have fat, subcuticular fat or loose pockets of fat, we can treat those as well. So before the procedure, we're going to take some pictures. We're going to both talk about which areas we want to treat, and you're going to tell me exactly what you want to do, what you want to accomplish. We're going to get you on the treatment table, and we're going to get you in a really comfortable position, and then we're going to place the applicator on your area, on the bulge that you want to treat, and then we'll turn the machine on and let it go to work for the next hour. Coolsculpting at first feels like a firm tug on your skin and your fat. You're going to feel a real intense pull, and it does surprise some people at first, especially if we're using a large applicator. It really pulls. Not so much that it's so painful that people can't endure it, but it is uncomfortable for the first 5 minutes. It can be uncomfortable for the first 5 minutes. I have never had anybody stop the machine and have to say, I can't do it, and have to leave. But it is slightly uncomfortable for the first couple minutes. You get used to it. And then some people will feel cold. Some people won't feel cold at all during the procedure until we take it off and they actually touch their skin. The applicator gets so cold, or the plates get so cold in the applicator that your nerves don't work, your cold sensing nerves don't work down to a certain point, so you may not feel it at all. After we take the applicator off and start massaging the tissue, you might feel a little tender. As it starts to thaw and you'll feel sensation again, it might feel a little tender just for a couple minutes while it's thawing, and then pretty much nothing at all. Yes, you absolutely may. There are no restrictions after the procedure. You can go back to normal life. Most people don't feel like working out that day of, but you can if you want to. There are no restrictions. Well, some people swear that they feel their clothes fitting better as soon as 2 weeks after the procedure. Most people, though, it's a very slow and gradual fat reduction, and you don't notice too much from a day-to-day basis because it's so gradual. So usually the whole process takes anywhere from around 2 to 4 months to be complete. Yes, the number of cells in your body after you're fully formed as an adult are the same. You don't multiply, you don't divide and make more fat cells after you're a fully formed adult. When you get heavier or when you gain weight, those fat cells that you have, that certain number of fat cells, they're just getting bigger and then smaller as you lose weight. You're not dividing fat cells generally. When we destroy these fat cells, they are gone. They are gone forever, so they'll no longer be able to gain weight in those fat cells that we destroy. You can gain weight in other areas of the body, but typically less in the areas that we treat. We are going to leave some fat cells left over, otherwise that would look funny. And those fat cells can gain and lose weight, but in no greater proportion than they did before.